Hello, my name is Corey Rutherford. This is my research presentation for course EDU 699. I'm a teacher of children with special needs in a Level 3 classroom at Eagle Grove Community School District, and I have been there for 4 years. My study is titled Effects of Daily Classroom Exercise for Secondary Education Students with ADHD. The problem. Teachers of the 21st century are faced with a very difficult task. That difficult task is teaching a diverse set of learners requiring management of an array of fluctuating behaviors. Teachers now face these issues with additional responsibilities in and outside of the classroom, declining school budgets, and lack of available resources. Often these teachers face students that come from a vast range of homes and backgrounds. Students come from homes where disruptive behavior, aggression, lack of attention, and defiant behavior is the daily norm. Due to these behaviors, teachers are faced with the sad reality of challenging behaviors in the classroom. That leads to the inability to create and proctor productive lessons and curriculum. For the learner, whether being distracted by behaviors of others or by being a learner that struggles with focusing, the challenge of tackling the material may seem insurmountable. It should be no surprise that one piece of this difficulty is getting the learners to focus enough to master the material. One of the most prolific diagnoses of children that display the aforementioned behaviors is a child with ADHD. History. Attention deficit hyperactivity disorder is defined as a condition that affects children, adolescents, and adults. It is characterized by problems with attention, impulsivity, and hyperactivity. For example, a child with ADHD might constantly tap their foot or a pencil, which may indicate that their mind has wandered and they have an excess amount of energy that is preventing them from sitting still. Surveys have shown that diagnosis of ADHD is increasing. This is due to many factors, including more screening by pediatricians and primary caregivers, decreased stigma surrounding ADHD, and availability of better treatment options. In the past, students with ADHD were often stigmatized. These students were seen as fidgety and as disruptions to learning. Today, though, there is an overall drop in the stigmatization of students with ADHD. However, some stigmatization still exists. These students often suffer from peer-directed bullying, depression, low classroom achievement, and mistreatment by adults that do not understand their situation. Solution: use exercise to mitigate behavior with individuals with ADHD. Hypothesis: does periodic exercise decrease behavior in students with ADHD? Treatments. Currently employed evidence-based treatment for ADHD falls into two categories: pharmacological interventions and behavioral-based psychosocial treatment. Some effective treatments for curbing hyperactivity, impulsivity, and disruptive behavior include pharmacologic non-stimulant and stimulant medications. According to the Journal of Pediatric Psychology, psychosocial treatments include parent management training and school-based contingency management have also been proven effective. Although both pharmacological and psychosocial treatments are effective for a few individuals with ADHD, there are some who it will not be sufficient to control all behaviors. Bloomberg, Dickey, and Reddy suggest that physical exercise has powerful effects on the brain function and structure, and this one avenue by which neural and cognitive development can be affected over both the short and long term. Reddy also states physical exercise can be defined many different ways, but is typically considered a physical movement by the body with the intentions of developing physical fitness or health. The main variables used in experimental exercise studies include intensity and duration. Some activities include repetitiveness such as running and walking activities that incorporate cognitive skills. Purpose statement. The purpose of the study is to determine whether or not the use of periodic high and low intensity exercise can lessen symptoms such as inattentiveness or restless behavior and learning of ADHD students through the school day. It was hypothesized that low-intensity exercise prior to classroom work would lower the frequency of behaviors typical of children with ADHD. Burdwin recounts the use of behaviors intervention systems and behavior contracts as a means of correcting minor symptoms of ADHD. Unfortunately, many of these symptoms are not adequately addressing the perpetual recurrence of minor ADHD type behaviors, including toe tapping, inattention, and restlessness. The gap in the research. The researcher feels that the largest gap in the research is the lack of whole class involvement when implementing exercise-based interventions. It is thought that with whole class interventions, there would be a more improved level of involvement and acceptance. The working hypothesis is that Group B will display a decrease in inappropriate behavior throughout the 4 weeks of intervention, leading to the increase in productivity for teachers and students. Methods. The study was done in A-B design. The A group will be observed throughout a 4-week process with no intervention. The student's behavior and overall attention will be monitored and graphed based on the percentage of time they are focused when compared to the time they are displaying inattention or an off-task behavior. During a 30-minute observation in a general education classroom, the researcher will note any off-task behaviors for pre-selected ADHD students. Group B will be observed for the concluding 4 weeks. The group will also take place in a general education classroom. This group will be monitored for 30 minutes also for similar off-task behaviors or lack of self-control after 3 to 5 minutes of low-intensity physical activities such as jumping jacks, push-ups, and walking. Participants. The participants for the study includes 7 9th through 12th grade special education students with attention deficit hyperactivity disorder who live in a small rural district located in north central Iowa. The high school used in the study has an enrollment of 230 students in grade 9-12. The materials that were used to progress monitor the participating students consisted of a list that was provided to teachers of low-intensity exercises that can be implemented prior to assigning classroom work, such as and including yoga, stretching, and walking. For example, a sheet was provided for in-seat yoga describing the proper procedure and duration of the exercise. Procedure. The research study began in the fall of 2016 school year. It was conducted over an 8-week period ending in December 2016. The design of the study was A-B style. The first phase of the study, A phase, was 4 weeks. Students received no treatment, but were monitored 30 minutes, 3 times a week for behaviors inherent to ADHD. Phase B. Starting at week 5, Phase B was implemented. Phase B involved implementing low-intensity exercises before students were expected to perform classroom work such as book work or coordinated group work. Participant students, along with the entire class, participated in low-intensity exercises in order to maintain anonymity of the test subjects. Exercise included calisthenics, stretching, yoga, walking around the room, walking up and down stairs, walking through the hallways. During the Phase B, behavior frequency was monitored throughout 30 minutes of the class time. This data was collected daily in general education setting. The researcher averages scores of observed behaviors over the course of 1 week. The average was compared against the control group, which also had an average score of 1 week. Data was presented in a bar graph form that compares 2 groups week by week. Theoretical framework. It is theorized that Howard Gardner's 6 intelligence, interpersonal intelligence, can be affected by the use of exercise to better outcomes for those with ADHD. Interpersonal intelligence is described as the ability to understand and interact effectively with others. It involves effective verbal and nonverbal communication, the ability to note distinctions among others, sensitivity to the moods and temperaments of others, and the ability to entertain multiple perspectives. Data analysis and results. The study examined the effects of low-intensity exercise on children with ADHD. The hypothesis was that the low-intensity exercise prior to classroom work would lower the frequency of behaviors typical to children with ADHD. The independent variable of the study is the children with ADHD. The dependent variable, the effect of exercise, was not found to have significant support. The p-value equals 0.238. A phase. The first 4 weeks of the collecting was collected in the A phase of and the experiment a set of the baseline data. This data was taken from all 7 participants in the study. The mean and standard deviation was collected for A phase and B phase. A phase mean for behaviors was 9.78 per 30 minutes. Phase B, the next 4 weeks phase hypothesis was supported. It was found that the experimental class of students that completed exercise before coursework averaged less behaviors per 30-minute class period. They averaged 9.28 behaviors per 30 minutes with a standard deviation of 4.35. Discussion. At the beginning of the research, it was hypothesized that low-intensity exercise would decrease the number of symptoms that a child with ADHD would display in 30-minute class period. The hypothesis was confirmed, but only to a very small degree. During the A phase of the research, the selected students averaged 9.78 behaviors per 30 minutes. The number was found by averaging the number of behaviors per 30 minutes through the 4-week period. It was found that in the week 5 through 8 that the behaviors decreased by 1/2 of a behavior per 30 minutes. Implications. As the research was being performed, the school district in which this research was performed showed interest in outcomes and findings. Educators that experienced the effects of this study found that implementing these strategies into their weekly lessons would be practical and effective. Currently, my school district is looking for the best way to implement these strategies for all the students without taking time away from instruction. I am currently using the strategies weekly in my classroom and have seen a great reduction in symptoms of ADHD. These strategies work very well with special needs students because you can modify each exercise to the needs of each student. Limitations. Though the results are not significant, it can be said that these strategies worked. Throughout the study, there were students that did not respond well to periodic exercise. This caused behaviors due to oppositional defiance. The researcher believes not allowing them to get an accurate interpretation of the effects of exercise. Due to the complexities of ADHD, it is hard to quantify the severity of the effect of each child's disability and their individual responses to each exercise. It also needs to be considered that students can react differently to very different stimulus when similar reactions would be expected. According to Ellenberg, 2010, the effect of exercise on cognitive function can be masked by underlying behaviors issues and the effect of immaturity in students with ADHD diagnosis. The results that were found closely resemble those of previous studies. Due to this success with individuals, but not when administered in group setting. In other studies by L.J. Hill, exercise was observed. Benefits occurred only for participants who exercised during the second week, which would be similar to my second phase. It was determined that test scores were adversely affected by age, sex, and level of ADHD symptoms. Recommendations for future research. The validity of the study was compromised due to the inability of to fully determine the effects of exercise on cognitive processing due to the students with behaviors and other outside forces. If this study was attempted again, it would be treated as a pull-out program. Having students perform the exercise outside the classroom would benefit future studies because teachers would be able to see a more targeted effect on those being studied once integrated back into the classroom. It has also been suggested to lengthen the study by better understanding the effects of each individual's disabilities. This would allow a more accurate determination and successful preceding treatment. It is also felt that it would be beneficial to explore more options for